Good morning. Just like vaccination and masking, getting tested is another effective mitigation strategy to protect yourself and your loved ones from COVID-19. Testing helps us identify new cases quickly and gives you critical information so you can take action to stop the transmission of disease to your loved ones and to the community. But there are still questions around testing. One is, when should I get tested? With the high rates of community transmission in St. Louis County, you should get tested if you have any symptoms at all or if you were a close contact to someone with COVID. If you're symptomatic, get tested immediately and isolate until you have your test results. If you were a close contact to someone with COVID, please get tested 5 days after exposure to them or if you start feeling any symptoms. Another common question centers on the different types of tests and their effectiveness. There are two categories of COVID-19 diagnostic tests, molecular and antigen. Molecular testing, often referred to as PCR testing, will detect the virus's genetic material. These tests are performed by a lab or a medical provider. These are considered the gold standard in testing. They're highly sensitive at detecting the virus in your body and have the advantage of detecting the virus earlier. Antigen tests detect proteins on the surface of the virus. Antigen tests can be performed at home, like the testing kits you can order for your family at covidtest.gov. These tests are less sensitive at detecting the virus. However, they are good at detecting the virus during the infectious period, meaning when you're most likely to be contagious and to spread disease to those around you. So which test should you get? If you have access to the molecular PCR test and you have symptoms, this is the best option. And that's the test offered at our Department of Public Health sites. If you only have access to an antigen test, then please use it. However, if you have symptoms and test negative on an antigen test, we recommend follow-up testing. Ideally, follow-up testing is a PCR test to confirm, but another option is a second antigen test, approximately 24 hours later. If you test positive, you must isolate for at least 5 days or more if you still have symptoms after 5 days. If possible, getting a negative antigen test to confirm that you are no longer infectious after your isolation period would offer an additional layer of confirmation that you will not get anyone else sick. If your employer requires a negative test to return to work, please consult with them to make sure you understand what their requirements are. Testing by the Department of Public Health is available at our 3 permanent health clinics in Berkeley, in Pine Lawn, and Sunset Hills, as well as another site we set up earlier this month at the North County Recreation Complex. These are all PCR tests. And beginning this morning, the Health Department is providing free COVID-19 test kits at 2 St. Louis County library branches. The Rock Road branch is located at 10267 St. Charles Rock Road, and the Weber Road branch is located at 4444 Weber Road. These saliva PCR test kits are available through the library, and they must be reserved by calling 314-994-3300. The kits will be available for curbside pickup at the 2 branches, and there's a limit of 2 test kits per person. Please do not show up at the branches without making a reservation by phone. Each test kit comes with detailed instructions. Test kits must be returned to the Department of Public Health at one of our health centers at the drop-off site. And this is needed for processing and analysis. The addresses of the health centers are located with information that comes with the test kit that you pick up from the library branches. For testing at the 4 locations, appointments are necessary, and they can be made at revivestl.com. And that's for testing at any of our Department of Health locations. This website, revivestl.com, is also where you can get information about vaccines. And if you don't have internet access, please call 314-615-2660. We appreciate this expanded COVID partnership with the library, a partnership which we've been using since the past year for more COVID vaccine access. So far, the library's been able to provide 3,200 shots. Our response to this pandemic has required us to build partnerships in the community, and we continue looking for ways to do so, so access to vaccines and testing will be available to everyone. Thank you, and I'd be glad to answer any questions.
Going to about the test, I'm curious to know, is there like a time period when you all open up? I know you like kind of refresh it every day after you get out the max, but is there a time where people have to call in or can start calling in, or is it just kind of open availability there?
So the question is about what time we can start calling. I would start calling now for an appointment for those test kits at the library.
Moving to your N95 mask, I know that those are not going to be given out really by mail. People are going to pick those up for the most part. What role are you all going to play in helping get those distributed?
So the question is about the distribution of the N95 masks, those are available through the federal government through their website. If we have more N95 masks, we'll certainly make those available currently. I don't know what our relationship with the federal government is to distribute those masks. I don't have that information yet.
Are you all prioritizing who you're giving your test to by age or zip code, symptoms, or is it just first come, first served?
So the question is about access to the tests. We have, 3 of our testing sites are in North County, the North County Recreation Center and Pine Lawn in Berkeley, and those are for ease of access to the residents of North County, recognizing that our North County residents have been hit hardest by the pandemic. As far as who gets access to the tests, anyone who calls and asks for a test and is able to make an appointment, then we'll provide them access to the test.
Absolutely. You have an email available for people to report their tests. Are you all just wanting to have that data? And then what about people beforehand who were taking at-home tests who there was an avenue to do so? Do you want those numbers, or are you just moving forward?
Your question is about the people who are taking at-home tests and how do we collect information from them, and we have an email address that's available. I don't remember that off the top of my head, but it's on our website at revivestl.com. We are interested in collecting information from someone who tests positive with an at-home test, and that's going to be especially important as at-home tests become more available in our community and as they're more available through the federal government. If more people are using at-home tests than the PCR test, then it will be difficult for us to track the caseload, difficult for our country to track the caseloads if those most of the testing is done with at-home tests. So we understand the value of the at-home test. We understand that people need to know if they're positive or not so they can react appropriately and take the appropriate precautions. But the public health community, our state agencies won't necessarily have the information and be able to track those numbers unless people report and let us know when they test positive. So it's very important that people let us know, but we also want and expect people to become familiar with these testing differences. That's why I'm talking about them today. I want everyone in our community to become familiar with the different types of tests so folks can begin to test themselves and so they can know what to do.
And for those who have already tested positive, are you still wanting to collect that data?
Yeah, if anybody who's tested positive, we'd like to know about it, sure. If it hasn't been recent, we'll still collect that information and track it. If you tested positive a week ago or 2 weeks ago, sure, we would like to know that. If you've tested positive recently and there's time to give you advice or recommendations about what to do, then letting us know allows us to provide that advice.
Last question for me, just follow-up question from last week. Are you able to give us any insight on the new police chief that we could possibly come into contact with here soon? Any timeline?
No news on the new police chief or the selection of a new police chief. I would refer you to the police commission.
Any other questions?
Okay, thank you.
Thanks for answering all my questions.
Anytime, buddy. Thanks.